Good afternoon everyone. Last session we are discussing about several types of novel drug delivery systems. So today we'll continue with the same. We'll see one more kind of novel drug delivery, that is transdermal drug delivery. Last session we have seen mucoadhesive drug delivery system. So this session we are going to talk about transdermal drug delivery systems, how it is beneficial, how it is superior over conventional drug delivery, and like any other system, this is also suffers some disadvantages. Let us also have a look on them and see some applications and marketed examples where we are using this transdermal drug delivery system. So let us start this session. So my name is S.P. Kumar. We met already, so we'll continue the kinds of novel drug delivery systems. So today's topic of discussion is about transdermal drug delivery. So as the name is suggesting, transdermal, which means trans, the drug is transported across the dermal layer, that is through skin, across the skin. Trans is through the skin. So here we are achieving the drug delivery through the skin. So dermal is through the skin. So most of the drugs which are available in the market, almost 74% of the drugs available in the market, they are taken orally. So oral route is a much flexible route. It is economical route. Most of the patients feel comfortable to take a tablet rather than an injection, but still oral drug delivery system suffers from certain disadvantages. What are they? So there are certain drugs which undergo degradation in the acidic environment, or there are drugs which in some cases undergo degradation in the alkaline medium or basic medium. So these kind of drugs cannot be given through oral route. Why? If at all they are given, they are going to get hydrolyzed or they are going to undergo degradation in the gastrointestinal milieu. So we have to choose an alternative route. So transdermal is one of such routes. And let us take one more example. Suppose there are certain kinds of drugs which undergo extensive first pass metabolism. So what is first pass metabolism? So our body anatomy is designed in a manner that all the nutrients they are going to absorb from the GIT tract. So from these, all the venal supply will be going to hepatic portal vein, and they will drain the nutrients containing blood into the liver. So why is this anatomy there in the body? Our circulation cannot handle the nutrients, so all the metabolism etc., the main principal metabolizing organ is liver. So hence all the nutrients will be conveyed to the liver by using this hepatic portal vein, such that metabolism can take place. But unfortunately this kind of anatomy is harmful for certain kind of drugs. So what it is? Certain drugs, they will, during the first pass itself, they are going to come to the liver, they are going to convey to the liver, where they are going to undergo metabolism, which is termed as first pass metabolism. So a drug should metabolize after showing its effect, but if it is metabolized before it shows its effect, during its first pass only, it is called as first pass metabolism. So such drugs cannot be given through oral route. So what is the alternative route? Alternative route is transdermal drug delivery. So there are many alternative routes. So transdermal is one of such deliveries, and there are certain drugs whose T-half is very low, their biological half-life is very low. So that means if the drug is having a T-half of 1 hour, every 2 hours the drug needs to be taken in order to show its effect. So which is quite inconvenient to the patient. So hence we can load number of doses, 3 to 4 doses into one patch, and we can administer to the patient. So these are the areas where transdermal drug delivery system has been successfully implemented. So we are going to see all of such points in this topic today. So drug delivery through the skin for systemic effect is commonly known as TDD. So here he is giving what is TDDS. So we are providing the drug through the skin for a systematic effect. So even though there are some local affecting drugs, mostly we are using for systemic effects. So not every drug can be given as the transdermal. There are certain criteria. We are going to come across those points. So this is the content from the first slide. So let us move on to the next slide. So where we are going to see further topics regarding TDDS. So they are commonly known as patches, nicotine patch or hormonal patches or oral contraceptive patches. So all such things they are given by transdermal route. So let us see a definition. So let us form from 3-line definition. So these are the dosage forms designed to deliver a therapeutically effective amount of drug from outside of the skin. So as you can see in the diagram, we are using a patch which is placed outside of the skin, and it is releasing the drug into the skin. So here is your skin layers, there is drug outside, your drug is permeated across the layers of the skin, so from which there are the venous supply blood vessels. These blood vessels are going to carry the drug into the heart. So from the heart the drug is distributed all throughout the body. So that is how the TDDS system is working, and that becomes its definition. So let us see the next slide. So what are the advantages? No one will utilize a technique unless otherwise it is having some advantages. So let us see some advantages. Advantages are, it avoids the stomach environment. Since you are delivering the drug directly into the skin, you are avoiding the stomach environment, acidic environment. Hence you are thereby allowing the acid sensitive drugs to deliver successfully into the systemic circulation without having any degradation. So point number 1 is checked. So we are able to deliver even an acid sensitive or basic sensitive drugs. Next, there is no GI distress. So there are certain drugs like aspirin or bisacodyl etc. These drugs causes GI irritation or GI distress. Let us take some anti-cancer agents itself. They can cause gastric distress. So even though anti-cancer drugs cannot be effectively used as transdermal, but there is a way. So we are saying that certain drugs that causes gastric distress can be given through skin such that we can avoid that stomach upset. Next, it is easy to use. Even a layman, so not like injection needs a skill to administer, needs some proper technique to deliver into the layers of the skin. Transdermal is non-invasive, it is very easy to apply. Suppose if you want to take away the drug, simply we will remove the patch. So administration is easy, withdrawal is also easy. So it's not the case with a tablet or an injection. Once it is entered inside, it is very hard, unless otherwise we perform a dialysis, we can't take the drug. So patches can increase the patient compliance. They will increase the patient compliance and they will decrease the medical cost. Since one patch is enough for 4 or 5 days or even some months, we can have better drug delivery to the body. So what else it does? What else it does is it avoids the first pass effect, as we have seen from the previous slide. So we can avoid the first pass effect, since the tablet is not reaching into the stomach and it is not entering into the liver through hepatic portal vein. We can have a avoidance of the first pass effect. It will directly reach into the systemic circulation. So if a transdermal drug delivery system is used in place of injections, it becomes a non-invasive method. So most importantly, this is a non-invasive method. So what is more friendly than a non-invasive method? So just like how tablets are so popular with their non-invasive routes, so these are also very popular with their non-invasive methodology. So what are the other advantages of TDDS? So it allows for the effective use of drugs with short biological half-life. Suppose there is a drug whose T-half is just 2 hours or 1 hour. So that means every 4 hours the patient needs to take the drug. So which not only causes discomfort to the patient, it may also affect the activities of daily living. So the patient may feel interrupted due to repeated administration of the tablet. So hence we can provide a patch which consists of 2 to 3 doses at a stretch, such that once it is applied on the body, it shows its drug release all throughout the day without having any discomfort. So it allows so let us see the next point. It allows for the administration of drugs with narrow therapeutic window. Suppose you are giving a conventional tablet. So what's the problem with a conventional tablet is there is a crest and there is a trough. Crest and trough. So this crest and trough may cause excess of maximum safe concentration or below of this minimal effective concentration, both of which are not recommended. So whenever a dose is reaching maximum safe concentration, it may cause adverse effects, and when the drug's plasma concentration is less than the minimum effective concentration, it causes therapeutic failure. So either way we are causing therapeutic failure to the patient. So hence transdermal drug delivery can avoid this massacres, either adverse effects or therapeutic failure. It can have a zero order drug delivery, a flat line throughout that maximum safe concentration and minimum effective concentration. It provides a steady plasma levels of highly potent drugs. So especially when there is a potent drug, say potent drug is the one whose dose is less than 80 mg, it has a pronounced therapeutic effect on the body, like a digoxin or lithium carbonate or aspirin. So all such drugs have a potent effect on the body. So such low dose drugs can be effectively given by transdermal route. So these are easy to use and non-invasive, so patients are more friendly towards this non-invasive techniques, as I have said earlier. So they are not like injections, but still they will be releasing the drug directly into the skin. From the skin the capillaries will be absorbing the drug and the capillaries will be taking the drug to the heart. So from the heart the drug will be distributed all throughout the body. So we are achieving the same effect without the use of needle. So hence transdermal are more popular in the market. So let me show you an example, a graph between time and plasma concentration. So as we can see, previously we mentioned about maximum safe concentration MSC and minimum effective concentration. So in order for the drug to be effective, always the concentration should lie between this therapeutic window. So we can achieve this flat line by using a transdermal drug delivery system where there are no crest centroids. There is a flat line which will show more effect on the body without having any adverse effects. So here is the example with the hormones containing oral contraceptives. So just like any other drug delivery systems, transdermal drug delivery systems are also having disadvantages. So let us discuss some disadvantages. So let us continue with some disadvantages. Disadvantages are drugs that require high blood levels cannot be administered. So TDDS is not suitable for the drugs whose dose is more than 150 mg. So according to Lipinski rules, the maximum threshold value of the dose for a TDDS system is 150 mg. So what if your dose is more than 150 mg? Because skin, the surface area of the patch and the skin area which is exposed to this patch can only take limited amount of drug. Greater than 150 mg may not be effectively reaching to the skin capillaries. So this may cause lesser doses. Your dose will be lesser than the minimum effective concentration, which again leads to therapeutic failure. So hence the researchers suggest that the maximum dose which can be given through TDDS is 150 mg, not beyond 150 mg. So even though there are strategies to deliver more than 150 mg, but it may not be as effective if the dose is less than 150 mg. So that's the reason why antibiotics are never given through transdermal route. Only other drugs like for chronic diseases, atenolol, all such potent drugs can be given by this transdermal route. So drugs that cause skin irritation or sensitization, say there are certain drugs which can cause irritation. So let us take the examples of adrenergic drugs. Say there are certain drugs like amlodipine or any parasympathetic drugs, they can cause skin irritation or allergy. Such candidates are not ideal for the transdermal drug delivery as they may cause more discomfort to the patient. So then they are given by oral route. So these patches can be uncomfortable to wear. See, these are definitely given on the areas which are inconspicuous to the environment. So hence they are given to the back side of the arm, or they will be using the shoulder blades. But still some patients may still feel discomfort to wear the transdermal drug delivery systems, and this system may not be economical for some patients. So since transdermal drug delivery involves more sophisticated polymers, it needs more and more money, which is not suitable or to bear the cost of that transdermal patch. So what are the adverse events? So here are the adverse events from the history where transdermal drug delivery have underwent a severe failure. So they thought to cause more advantage, but still they caused a massacre. So what are the examples? So in 2005 FDA announced the withdrawal of fentanyl transdermal patches. The reason is, fentanyl is 40 times more potent than morphine. So we already know what is the problem of morphine. Morphine causes respiratory depression. So fentanyl being 40 times more potent than morphine, if it is given, can cause overdose and death. So the patients who have taken this fentanyl transdermal patches, they got this adverse event called as respiratory depression, and there are some reported deaths, hence it was immediately withdrawn from the market. So the problem with this fentanyl transdermal patches is they developed a reservoir. In the reservoir there is this fentanyl drug. Unfortunately, due to the design problem, there is a rupture to this membrane which led to dose dumping of the fentanyl. All the fentanyl got dumped into the circulation, which resulted in the adverse event causing death and respiratory depression. So what we can do, we can overcome this problem faced by this fentanyl TDD patches by developing a matrix system instead of a reservoir system, where the drug is mixed with the polymer in equal elements, that is dispersed. So hence we can have a more uniform drug release into the circulation. So that is a lesson learned from the history with the fentanyl. So as I have said previously, not every drug candidate is ideal for transdermal drug delivery system. So there are certain things which should be borne in mind. So what are they? The dose, the molecular weight of the drug to be used in TDDS should be less than 500 kilodaltons. So here are some examples. Let us say nicotine. Nicotine is widely used as a transdermal patch. If you see the molecular weight, it is 162.24 daltons, and see the molecular weight of scopolamine, estradiol, testosterone. So if you see every molecular weight, its molecular weight is always less than 500 daltons. So why it is so crucial? Why? Because the gaps between the skin cells will allow the drug whose molecular weight is less than 500 daltons only. If it is more than 500 daltons, it may not pass through the tortuous cavity in between the skin cells. So hence it is very crucial to remember that magical number. The magical number is 500 daltons. Always your drug weight, molecular weight should be less than that 500 daltons. So what is the, all the success of the TDDS system depends upon the site where you are applying the patch, and so for that we need to know the anatomy of the skin. So this slide describes the anatomy of the skin. So human skin is the most readily accessible surface, and it also provides the maximum surface area. If you see the number, it is 2 meters square of area. No other body cavity provides such a huge enormous area. So hence TDDS are so successful in the market because they can be easily applied onto the skin. So as if you see the anatomy of the skin, it is comprising of this epidermis, external layer, and dermis, internal layer. So there is also this fatty tissue. So above the epidermis there is one layer called as stratum corneum, which is made up of dead cells. So the rate limiting step in the absorption of transdermal systems is this stratum corneum. If your drug is able to cross through this stratum corneum, your drug release is going to be high and the effect is going to be high. So the only thing for the success of TDDS system is its ability to permeate through this stratum corneum. So if your drug is, so what is the characteristic to have get past through this stratum corneum layer? So the characteristics are, it should be lipophilic in nature, its molecular weight is less than 500 daltons, and its log P value should be closer to 5, just like the Lipinski rule. So then your drug is going to permeate across this stratum corneum layer, and the rate determining step is solved. So the only problem with this TDDS system is this stratum corneum layer should be borne in mind while you are designing the TDDS system. So here is the microscopic image of the skin. So out of all these layers, the one which is restraining the drug to be released into the skin capillaries is stratum corneum. So it is an enlarged microscopic image where you can see these dead cells, a clear image of the clear dead cells. So here is another way of representing the human anatomy of the skin. So where we have also incorporated these oil glands and sweat glands, etc. So why this image is given is, so we need to keep in mind that our transdermal drug delivery should not interfere either with the sweat production or with this oil sebum gland or sebum secretion. So make sure that your drug design or drug therapeutic profile does not cause interruption through these sweat glands or oil glands, which may affect the homeostasis of the body. So hence make sure that there is no sensitization of these sensitive glands. So what are the transport mechanisms? Once we selected the drug and selected the drug system, so the thing is how the drug is delivered to these capillaries, skin capillaries. So those are called as mechanisms. So mainly the drug can be released by transepidermal pathway or transfollicular pathway. So transepidermal in the sense the drug is permeating across the layers of the skin. Out of all these layers, the one which is causing restraining is stratum corneum, as we have seen previously. And there is also another route by transfollicular pathway, that is through the skin hair follicles. So we can also release the drug through skin hair follicles. So here is a nice illustration of how a drug can pass into the skin capillary. So this is intercellular route. So the gap between the skin cells can be used to release the drug to the skin capillaries, to the skin veins, or we can use a transcellular route. Suppose our drug is a lipophilic drug, it can pass or permeate through the cell membranes, phosphobilipid membranes, to pass across the skin capillaries. So now we have seen all the advantages, disadvantages, drug and the anatomy of the skin. Let us see the design of TDDS system. So basic design of a TDDS system consists of a backing membrane which is impermeable. So this serves as a protective membrane on the back side of the patch, on the dorsal side of the patch, and there is this main drug containing layer. There is a membrane which is a rate controlling membrane, so it will control the amount of drug released into the skin from this drug, and there is an adhesive to attach this patch. Adhesive is used to attach the patch to the skin. Finally there is a layer, protective liner, which will protect this patch unless otherwise it is administered onto the body. So there are 3 generations in a TDDS system. So the first generation will not cause any disruption to skin permeation. They do not cause any disruption to skin permeation. Whereas generation 2 and generation 3, they disrupt the skin permeation and allow for the more accessibility of the drug. So in this, either we can use a drug reservoir system where the drug containing layer is bounded by a membrane. So once this membrane is dissoluted, the drug is slowly passing into the skin cavity. So there is also a matrix system where drug is mixed with the adhesive or polymer, such that even though there is a rupture to the membrane, so the problem with this drug reservoir system is dose dumping will be present. Such a dose dumping mechanism will not be present with the matrix system. So that's, so when you ask for a question which one is more superior, matrix systems are more superior as they cause lesser release of drug into the body and there is no dose dumping. So here are some marketed examples. So estraderm and androderm, so both of them are steroidal hormones mostly. So this one is used as an oral contraceptive and this one is used as an anabolic agent, and also for treating severe anorexia nervosa. So or nicotine patch for nicotine addicts or smoking addicts, nicotine will be used as a patch. In either case we can have a slow release of drug into the systemic circulation. So second and third generations, the extra advantage of these second and third generations is they cause skin disruption. So by skin disruption we can facilitate even higher molecular weight of drugs. So earlier we had a point that the molecular weight should be less than 500 daltons. What if your drug is more than 500? Then we can use this second generation and third generation patches where skin disruption can be used to facilitate the delivery of higher molecular weight drugs. So this disruption, whatever we do, the mechanism, either electrical mechanism or other heating mechanism, it should be reversible and should avoid permanent injury to the skin. So these things should allow better release of the drug into the skin. So the enhancement techniques include, we can use chemical penetration enhancers like DMSO, or we can use gentle heating, or we can use electrical current to pass the ionized drugs. So here are some chemical penetration enhancers. Examples include DMSO, dimethyl sulfoxide, ethanol, methanol, so all glyceryl monolaurate, stearates, or these marketed drugs like Cepa or Azone. These drugs can cause more permeation to the skin and facilitate larger molecular weight drugs into the body. So we can also use a small pulse of heat. We can use a small pulse of heat to deliver the drug into the body. So that is the controlled heat assisted drug delivery system, so where a small temperature for a fraction of seconds can be used to permeate the drug. So example of such delivery is lidocaine or tetracaine. Both are local anesthetics. Since these are xylidine derivatives, they cannot be given directly without this heat assistance. So this is also third generation, where we are using iontophoresis. Iontophoresis is we can use electrical current to deliver positive and negative drugs. Usually drugs in the unionized state can only be absorbed. So what if your drug is in ionized state? We can use iontophoresis to deliver the drug into the skin. So here is an illustration. We will use a small electrical current with the help of a battery. So if it is a positively charged drug, we can use this negative charge to deliver the drug into the body, or in the contrary, opposite charge. You know that unlike poles attract each other, so we can use the opposite charges either to deliver or withdraw the drug from the skin. So wireless patch. So here this is a more sophisticated version, where we can use a wireless control system to deliver the drug. So in a timed manner we can use a wireless delivery such that the drug will be released in a frequent intervals rather than a burst release. So third generation. In the third generation, the extent of skin disruption is very high. So here we are using a more severe skin disruption techniques such that more and more heavyweight drugs can be given into the drug. So here is the skin disruption. Here we can see the skin cells are intact. Here we can see a more bridging gap between the skin cells, which allow for the more permeation of the drug. So one example was given, so that is gonadotropin releasing hormones. This is a very larger oligopeptides. As you can see the structure of the drug, but still it can be given by using this third generation technique, so such that the skin disruption will be increased and more amount of drug will be released into the body. So we can also use thermal ablation in the sense we can employ higher temperatures for a few seconds, like 100 milliseconds or 100 seconds, such that the skin cells can expand and accommodate more drug to be delivered into the skin capillaries. So we can also use, other than electrical charge, we can use ultrasound waves to release the drug into the skin capillary. So this is an illustration which describes how the ultrasound waves can drive the drug, act as a driving force to deliver the drug into the body. So here is the practical demonstration. There is an ultrasonic transducer. This transducer is employed to drive the drug into the skin. So once the procedure was completed, it is closed with the impermeable patch such that the drug is in the body for longer periods. We can also use micro needles. So in the next two slides we are going to see these micro needles. So these are penetrated into the skin, which forms a patch, and into that patch the drug will be slowly releasing into the body. So we can the one previously shown is a solid needle. Unless solid needle, we can also use a hollow micro needle, where there is a needle like presence in the system such that the drug will be slowly released into the skin from these hollow needles. So here is a marketed example. So this Intanza, which is developed by Intas company, which delivers the flu vaccine through this route. So finally, the conclusion is transdermal drug delivery systems are the most successful systems. It's a very complicated but yet useful non-invasive method of drug delivery to the patient. So the drugs having lesser T-half, lesser dose, and those you have lesser biological half-life but still want to have the drug release for longer period of time, TDDS is the better route. So in the next session we are going to see other kind of novel drug delivery systems. Thank you.